Hello people, in this video let us look at this book, Practical Manual of Pharmacology for medical students. So this is by Dinesh Badyal. Let's look inside this book. It's a pretty black and white book, though the cover is so colorful. Okay, there are some images here. This is a plate they are calling. Where you should give the injection, are they showing that? So you should feel these bony surfaces, and then they are telling you should give, the area of injection is here between these two fingers. For subcutaneous, this is, I think, for the insulin, they are showing in the abdomen, right? Guys, look at this book. This can also work as your record itself, because here they are showing there is place for your staff to sign, etc. Look at this. So this is the name of student, roll number, email ID, mobile number, photo. So basically here there are place for signatures also after you have completed your practical, right? Logbook, certificate, faculty, signature, etc. Signature of your HOD, and when you finished, what dates, all that you can enter here. So basically this not only works for you as a reference, even for your college, if they don't want to print any separate record, right, then it will be helpful for them. So these are all the plates that they have given. We'll come to this. So the contents in practical pharmacology. Focus guys, we are looking at this book, Practical Manual of Pharmacology for Medical Students, right? So look at this. So you have the instruments they're talking about here, drugs, sources of drugs, route of drug administration. All these are for, dosage forms and route of drug administration. Focus people. Then loading dose means what? So in MI they'll give a loading dose of what? Aspirin, clopidogrel and atorvastatin, right? Then in children you should be very careful. In children, people, focus here. You should know how to calculate paracetamol, how much to give paracetamol, how much to give amoxicillin. Basic things you should know for children, okay? Then simulation based experiments. So basically here they are talking about animal toxicity, behavior of the animal after giving a particular drug like digoxin, etc. After you give a high dose of calcium or potassium, what happens? So this is basically simulation. We are not going to torture the animal because we already know the results, right? So experiments are allowed on live animals only if we do not know the result. But now for you it is going to be only computer simulation. Clinical pharmacology. So what are they talking about here? First pass metabolism, half-life, all this. You may not have everything from your college, but at least you should know all this for your Viva, right? Adverse drug reaction monitoring, all this is very important in terms of hospital setup, right? So you should know the adverse drugs that are known, right? And anytime that it happens, you should report this. You have to report the adverse drug reaction, which your pharmacology in your college, those people will be doing that. So in case anything is there, they will call your pharmacology people to file the ADR, right? What else? So here they are talking about the ADR form. So look at the book now. At the end of every book, they have told you that the objectives of this chapter, right? You should understand all the labels of drugs, right? How will you interpret the label? You should always check the name on the bottle before giving the drug, right? You should also check the expiry date. Very important. Then what when all you'll see, manufacture date, all that. An ampule means what will be there. What is the difference between a vial and an ampule? Right? What is an ampule? You'll break it and you will get the drug, right? This is one time. You cannot reuse. But a vial you can reuse. Like you can take, like vaccines vials are there. You can draw 3 times, 4 times from the same vial, right? And what is this? There are some question answers, so you can answer here and submit it to your staff as a record itself. Now coming to the next pharmacy formulations they're talking about. Okay, there are some black and white images here and there. Are you able to see? A lot of theory is there here, so you can learn very easily for your Viva. See, one thing you should know is drug use in special population can be pregnancy. You should know that teratogenicity, right? You should know what, you should not give doxy to female who are in reproductive age. It's better to avoid doxycycline, etc. Ethics and animals, they are teaching you, like we told you, that when you know the result of the experiment, better not to use a live animal, right? Then ethics in humans. So obviously clinical trials also you should know about, right? You cannot go and inject these cancer trial drugs into human beings without taking their consent, without explaining to them the side effects of those things. Clinical pharmacology. Problem writing, dose calculation. So you should have calculator for this, guys. For pharmacology, I remember we were allowed calculator where we could calculate the dose. Okay. And what is this? Okay, this is how to write a prescription. This is a model prescription. Very important. Focus people here. See here they have given the name of the doctor, his qualification, his address, his email ID and mobile number, right? And the date of that writing this prescription, for whom, the patient's name, address, patient's age, mobile number, email ID, etc. Then this is the prescription. Look at this. There is a tablet. It's a tablet of omeprazole, which is going to be an anti basically for your gastritis, for your antacid, right? I don't think you can call it antacid. What do you call it? It's a proton pump inhibitor, right? PPI, just like your pantoprazole, etc. So then focus here, people. Then you have the followed by the tablet. How much? Which tablet? There will be different combinations available in the store. You should say give that 20 mg tablet to this guy, and he's going to take one. What is this? This is a bar, I think here. OD means once daily, right? 30 minutes before breakfast. So this is something, this is very specific for this tablet, that you have to take it before the breakfast, right? And take it for 6 weeks. OD means once daily, but yeah, before breakfast means in the morning, right? Right. Look at this last one. Capsule, amoxicillin capsule, 1 gram, 3 times a day. So all this makes sense. Then what is this I here in the middle? Okay. And here some extra advice is given here. So avoid some other drugs. And at the below, what are they telling here? How much to dispose for the pharmacy they are telling. Give 42 tablets of this. Give 1 bottle of this antacid gel, etc. Okay. For capsule amoxicillin, why they didn't tell how much to be disposed? And what is this tablet omeprazole, 20 mg 2 times a day? What is that? When they have written here 1 time daily, why did they write here again this? I didn't understand that part of it. Then how will patient understand? And then the signature of the doctor with the date. I think below the sign there should always be the name of the doctor, his seal, etc. Dispense, the pharmacist will enter here when he dispensed it, etc. So what have they written here? Alternative drugs also they mentioned here. Alternative to omeprazole is pantoprazole, etc. Okay. So basically this is how you will write prescription, guys. This is very important. Then basically in countries like America, etc., this prescription, without prescription they will not give drugs. In India you can still buy a lot of drugs by asking the pharmacist, but it doesn't work like that there. Okay, then there are some case studies here type of thing. Let's look at one of this also. What do you say, people? This video became very long for you, right? Anyways, we are looking at this practical manual of pharmacology book. Hope you are learning something also by it. So let's look at this. Ashok Kumar, 48-year-old male, complained of dyspnea, cough, easy fatiguability, swelling over lower limbs. His BP was 170, 130 mercury. What should you do? This book does not give answers, which is bad. I wish they would have given answers also here. Anyways, here it looks like swelling is there, and also there is high BP. You can give them a diuretic definitely. And for cough, you can give some chlorpheniramine type of antihistaminic, right? Then, what is dyspnea? Dyspnea, difficulty in breathing. So you'll have to give oxygen if the saturation is low, etc. Then you can check his GRBS because easy fatigability. You should do an ECG also in this. So basically, they're expecting you to give a prescription. In fact, that patient may need a complete workup with CBC and all those blood investigations, etc. Okay. My only complaint is they could have given the answer also, isn't it? Could have been very fast learning for us. Whether it is spoon feeding or not is a different thing. For learning, we need the answers, right? There is another section here called as teaching, learning and assessment. How to teach. So if you're a staff who's using this book, you can learn how to teach also, which is nice, right? In which they are telling you can have some small group discussions, right? Where it's not like only one way the lecturer speaks and the students listen. No, they're telling have group discussions, right? Then what else? You can just look at all this, though it is not relevant to you as a student, right? How to assess a student whether they know or not, right? Practical, they will ask you to inject and do a IV. In fact, they were only teaching us IV injection, but when I went for the examination that day, they asked me to withdraw blood. So instead of injecting, I had to withdraw blood. So that you will have to be careful about. Practice everything. And as it was a doll, it really didn't matter how much pain it causes it. Then, I think that's all. Like I said, color images, only the initial part when we saw color images were there. It was no other color image, people. Everything is black and white only in this book, except those plates. Okay. There's something called essential drug list which they have not given in this book. I didn't see essential drug list. There's an ADR form which they have given, which is filled by the staff, right, medical staff, and there is another ADR form for consumers also to fill. Okay, that's all for now, guys. This book we have looked at very much in detail, practical pharmacology. Hope in this process of looking at this book, you have also learnt something. To summarize, this book is quite black and white inside. It is for, can be used as a record for your college staff. If they decide to have a pharmacology record, they can use this book because it has place for signatures, dates and all that. And also it has teaching methods, so staff can use this book to teach students. And one more thing is the answers are not there in this book, so that is a little sad. You'll have to search for the answers everywhere. So this is the practical manual of pharmacology for medical students. Bye-bye.